Bismillah ar-Rahman ar-Rahim. I will explain lecture strategy Staphylococcus agalactiae, prepared by Akram Muhammad Ikhel. Properties Staphylococcus. One is gram cocci, 1 U diameter, chain or pairs, fermented glucose, no form spore, non-motile, catalase negative, facultative anaerobes. Staphylococcus agalactiae. Staphylococcus agalactiae, also known as group B Streptococcus or beta strep, is a gram-positive coccus, non-motile and non-spore-forming, catalase-negative spiral or ovoid and less than 20 micrometer in diameter. It is usually P hemolytic and can grow in base or short chain. Staphylococcus agalactiae causes invasion disease primarily in newborn and in women in postpartum period. Adults with severe infection and related to pregnancy are usually elderly and have underlying illness such as diabetes mellitus, liver failure, malignancy, acquired immune syndrome, or renal failure. In non-pregnant adult skin or soft tissue infection, bacteremia, antigen infection, and pneumonia are the most common manifestation of disease. Streptococcus agalactiae. Asymptomatic vaginal or rectal colonization in 5 years to pregnant women, most common cause of meningitis in newborn. Mostly vertical transmission, but some horizontal transmission from the hands of nursery personnel can also cause meningitis. Epidemiology. Site of colonization. One is lower gastrointestinal tract, urinary tract. Sex of infant born to colonization mother become infected with mother organism. This can lead to pneumonia, bacteremia, and meningitis. Streptococcus agalactiae transmission. 90 or 30 of pregnant women have group B streptococci in their genital tract, although the bacteria is normally a resident of the gastrointestinal tract. During birth, the bacteria can colonize the baby via the antibiotic fluid or the mucous membrane, oral, nasopharyngeal, and anal mucus, as well as skin, and produce an early onset infection 40 to 30 hours after birth, last once case when 3 months after birth, may be contracted by contact with mother or the environment. Facial oral transmission may occur and sexual contact play a role in colonization. Hand to mouth and aerosol transmission is common for streptococci. A human carries the pathogen is there. A human carries pathogen is there. Humans carry the pathogen in their urogenital tract and their rectum. The organism is spread from the mother to the baby during birth or in cases with deficient antibiotic membrane. In the uterus, antibiotic treatment of the mother to create a genital tract group streptococci has shown to only be useful temporarily. As we see in picture, transmission of fetal post-membrane symptoms, sepsis, liver function, prevention screen, mom, antibiotic, dex culture gram. Prices here. And symptoms, we are losses, pneumonia. Streptococcus agalactiae symptoms include respiratory distress, fever, lethargy, interration, apnea, and hypotension. Incubation period for early onset disease less than 7 days. For late onset disease, the incubation period is unknown. Streptococcus agalactiae lab diagnosis. GPS is characterized by the presence in the cell wall of the antigen group B. Lancefield classification, Lancefield grouping that can be detected directly in intact bacteria using latex aggregation test. The CAM test is also another important test for invocation. Laboratory diagnosis. Presumptive identification test, gram stain, catalase negative bacterial bile synthesis does not go 69 cell CAM positive slide aggregation. As is shown are narrow shaped helmets near Staphylococcus text showing positive or count. Streptococcus agalactiae representation, the Lancefield group B hemolytic Streptococcus infection. Streptococcus agalactiae is the most frequent cause newborn infant. Antibiotic prophylaxis specific for GBC is not required for women integrating blind clinical certificate in the absence of labor and with intact embryos. Immediate indication of labor and lab should be offered by women's labor version 72 weeks guessing of more. If recommended substitute broad-spectrum antibiotic therapy including an agent active agent GBC specific lab and the indication of labor should be consultation. Transcurrent antibiotic pre-labor vaginal flushing as a crossing oral antibiotic advance. As discord number of cases. Education is 9 versus group B, Streptococcus and Spirens long. Ways used to picture Streptococcus pyogenes and Streptococcus agalactiae. Thanks for you.